There's not a day when Britain's National Health Service isn't in the news. With planned reforms to the National Health Service and recent reports of poor patient care in the media, it's facing a challenging time. I'm joined now by visiting Professor Chris Roebuck, who is a specialist in transformational leadership. You've recently written a report for the King's Fund about the state of the National Health Service, and you say that it's in a critical situation at the moment. Could you explain what you mean by that?
Yes, the NHS, having worked with the NHS at national level, at SHA level, and looked at what's happening in trusts, is at a critical point because it's been subject to so many change initiatives over the years. It's been subject to being a political tennis ball over the years, and what's happened is there's 1.4 million staff out there who are to some degree slightly confused about what's going on, where the future lies, and how they can contribute to great patient care. And what has to happen now is that some real practical leadership has to be injected across the whole organisation to make that happen.
As I said, there's been a lot in the news about poor patient care, and there was a recent report by the Quality Care Committee into the way the elderly are being looked after, and obviously this is a big part of the NHS's activities now. What do you think about the report?
Well, obviously, in an organisation of 1.4 million people with 400 trusts across the country, what's going to happen is that sometimes things are going to go wrong. But certainly, in those situations where things do go wrong, for example, in that report or at Mid Staffordshire, if something like that happens, there is clearly a leadership failure, either at operational level or at strategic level, and something has to be done to stop that. The bigger question is, how did that happen in the first place? And that's probably because whilst there is good leadership in the NHS, there are an awful lot of places in the NHS where the leadership is competent at best.
And so I guess let's get into the issue of leadership at the NHS. Is there really a proper leadership development programme at the NHS? I mean, how does the need for leadership change with all these proposed changes?
Well, the interesting thing is that the NHS for the last 2 years has developed a strategic leadership plan, and indeed many of the top quality trusts across the country have got their own development programmes. So there is something going on at strategic level. The critical problem for the NHS now is that, as we know from the private sector and other places, these strategic initiatives can take 3 to 4 years to percolate down through the organisation. The NHS doesn't have that time because we can't wait 3 to 4 years to have good leadership to ensure good patient care. So we need to have something done now to make sure that operational leadership is effective.
And if it takes so long for changes to get through in the private sector, who can the NHS learn from? I know you had experience in the military.
Yeah, there's a number of situations where the NHS can learn, and indeed the NHS can learn from the NHS. If you look at the military are extremely focused on delivering objectives where everyone has clear responsibility on outcomes. They're not focused on process. And as far as the NHS is concerned, whilst there are some really good organisations out there, what has to happen is that the knowledge of what's good in the NHS needs to be spread across the NHS more, and the NHS needs to look out to organisations in the private sector where they can take an idea and tailor it and make the NHS better.
And here's the £1 million or £1 billion question for the government. If it can't do all the improvements that it wants to within the NHS, within a restricted and limited budget, what should it be prioritising at this moment right now?
Well, the really interesting thing is that actually the leadership side of things doesn't have to be expensive. You can engage your staff, you can motivate your staff, you can align them onto what matters with really simple operational stuff in terms of pointing people. If you engage somebody, you can get 30% better performance out of them for no financial investment, and that's down to good leadership. So the sooner we develop the leadership, the sooner we get the engagement from the staff, and the sooner the patient care improves. And that can start happening tomorrow. You don't have to wait 4 years. If somebody makes a decision to say we need to offer every NHS organisation the opportunity and support to have great leaders.
Chris Roebuck, thank you very much for your time today.
Thank you.